Hey guys, I wanted to talk about pulmonary hypertension today. It's going to be really brief, so if you want a cheat sheet on this, just comment below. Also, if you want a right heart cath interpretation cheat sheet, then also comment below for that. So symptoms are going to be exertional dyspnea, fatigue, chest pain, syncope, and edema. You're going to want to screen with an echo. You're going to see RV dilation, high TR jet, an estimated PASP over 40 to 50, and that's a red flag. The gold standard of diagnosis is a right heart cath. So the numbers you're going to see is a mean pulmonary artery pressure. If it's over 20 millimeters of mercury, then you've confirmed pulmonary hypertension. Then is the pulmonary artery wedge pressure. If it's less than 15 and the PVR is over 2 Wood units, that means it's precapillary. Then if the pulmonary artery wedge pressure is over 15 and the PVR is less than 2, then that's pure postcapillary. If the pulmonary artery wedge pressure is over 15 and the PVR is over 2, that means it's a combined situation, which is a bad prognosis. So here are the different types of pulmonary hypertension. So group 1 is pulmonary arterial hypertension. So that's precapillary. That means that your pulmonary artery wedge pressure is typically going to be pretty low. This is like idiopathic. It can come from scleroderma, congenital heart disease, HIV, portal hypertension, meth. We treat this with like PDE5 inhibitors like sildenafil. You can also do endothelin receptor antagonists like bosentan. And then you can also do prostacyclin analogs like epoprostenol. Then there's activism traps like sotatercept. So then there's group 2. So this is pure postcapillary pulmonary hypertension. So the pulmonary capillary wedge pressure will be high. This is from left heart failure. So HFpEF, valvular heart failure. So you're going to want to treat whatever is causing the heart failure. Then you have group 3, which is from an underlying lung disease. So it'll be a precapillary pulmonary hypertension. You'll have a lower pulmonary capillary wedge pressure. This comes from like lung etiologies like COPD, pulmonary fibrosis, OSA. You're going to want to treat the underlying lung condition. And then group 4 is CTEPH, which is chronic thromboembolic pulmonary hypertension. This is basically when you get clots everywhere, and it increases your pulmonary hypertension. The treatment is like a pulmonary endarterectomy if operable. It's open heart surgery and very high risky. There's also riociguat, which is a soluble guanylate cyclase stimulator that causes pulmonary vessels to relax and widen and enhances the effect of the body's own nitric oxide. You could also try a balloon pulmonary angioplasty. And then there's group 5, which is multifactorial, and you're going to want to treat the cause of this. The cause includes sickle cell anemia, sarcoidosis, myeloproliferative disorders, chronic hemolysis, metabolic syndrome, thyroid disease, large dialysis AV fistulas. So basically, get an echo. If there's red flags, you're going to want to get a right heart cath, ideally when people are in a euvolemic state.